King Potassium has lost his power. The king of action and contraction in your muscles is now, well, weak and wimpy. Today we're wrapping up hypokalemia. So hypo meaning low, cal meaning potassium, emia in the blood, so potassium less than 3.5 in the blood. Now, potassium's main function is to maintain heart and muscle contraction through keeping each muscle cell charged or polarized via this sodium-potassium pump. Now, potassium is regulated by kidneys, which I call the washing machines of the body, because they filter the blood and get rid of excess substances, and in this case, potassium. Potassium is influenced by aldosterone hormone I call aldosterone, the security bouncer to the most exclusive nightclub in your body, Club RAS, the renin-angiotensin-aldosterone system in the kidneys. It's a super funny story I cover in our full course here at simplenursing.com. Main causes that drain potassium from the body and dump them into the potty. Well, we use the 4 Ds: dehydration, diuretics, diarrhea, and drains like NG tube suctioning and vomiting basically does the same thing. Simply all major fluids that leave your body have electrolytes. Because where fluids flow, electrolytes go! The simplest way to remember low potassium causes is using our acronym GOT SHOT. So G is for GI losses like vomiting and diarrhea. O is for osmotic diuresis, basically frequent urination, like with our diabetic patients with high blood sugar. They have to pee out all that sugar, and we lose a little potassium too. Thiazide and loop diuretics like hydrochlorothiazide and furosemide, also called potassium wasting diuretics, they pull that potassium from the body and then dump it in the potty. Severe acid imbalance causes disruption in potassium because remember, our sodium-potassium pump, which keeps our pH in balance, is being overworked. H is for hyperaldosteronism. Too much aldosterone is produced by the adrenal glands that sit on top of our kidneys, which leads to lower levels of potassium in the blood and increased alkalosis, which is more of a basic state. O is for other medications that deplete potassium. These will be our corticosteroids, which promote water retention, leading to a hemodilution, basically dilutional hypokalemia. Insulin opens up the cells and potassium sneaks inside, causing a low bloodstream potassium. Antibiotics like penicillins and aminoglycosides can induce renal potassium excretion. Transcellular fluid shifts, as mentioned before, using insulin, but also with albuterol. Pushes potassium into the cell, causing low bloodstream potassium. So what's going on in hypokalemia? Well, low potassium, right? And since potassium is the king of action and contraction inside your muscles, well then with less potassium, everything in the body is going to be low and slow. This hypo, low and slow, the king has lost his power. Boost the power! Do it now! Do it faster! Boost it! So the heart's going to be low and slow. You'll see vital signs like thready, weak, irregular pulses. Now the heart rate is a little bit tricky, so write this one down. Tachycardia is an early sign, and then bradycardia is that severe late sign. Orthostatic hypotension, which is basically low blood pressure upon standing. The EKG will be low and slow, so we'll have ST depression, flattened and inverted T waves, which is a big NCLEX tip. Prominent U waves, best seen in precordial leads. The ventricles are too relaxed, too low and slow. They're not depolarizing or squeezing properly. The lungs are low and slow, so slow, shallow breathing, diminished breath sounds. Now with severe hypokalemia, there'll be respiratory arrest from that cramped up diaphragm. And an NCLEX tip for you guys, words like profound and severe are late and serious signs, indicating a patient priority. So guys, be a good nurse and assess these patients first. The GI system will be low and slow, so decreased motility, hypoactive bowel sounds, constipation, abdominal distension, and even a big priority, paralytic ileus, which is a non-moving part of the small intestine that could lead to an SBO, a small bowel obstruction, and basically explode the intestines. Kind of like a fat kid getting stuck in a water slide. It's very, very dangerous. Neurologically, the brain's going to be low and slow, so loss of consciousness, confusion, anxiety, lethargy, or what we call fatigue. Muscles will have slow and weak DTRs, slow deep tendon reflexes called hyporeflexia, as well as weakness resulting in flaccid paralysis, meaning a feeling like you're paralyzed. Nursing interventions for low potassium. So what are we going to do about it? Well, it's a simple fix, really. Add more potassium. So use my nifty acronym AID. A is for administered K-DIR, which is our oral potassium. I is for IV potassium chloride via IV piggyback, something called K-Riders, or potassium chloride in normal saline. Caution, never push potassium. It's instant death. Now, lethal injection for death row inmates is not poison at all. It's actually just potassium. It just makes the heart cramp up and pretty much not pump anymore. Now, lastly, D is for diet. So diet high in salt substitutes, tons of fruit, avocados, and loads of green leafy veggies. All have super high potassium. Now, just in case you missed it, caution, never push the king, never push potassium. It's instant death. So be a good nurse and don't be scared, be prepared. All right, guys, that wraps up low potassium or hypokalemia patients.